What's up guys, my name's Dean. Today we're going to be talking about axillary crutches. Specifically, we're going to be going over how to fit the axillary crutches, how to do a confirmation of fit to make sure you have the right size set up, how to do a sit to stand maneuver, as well as how to do a stand to sit maneuver. You can do this from either a chair or a wheelchair, or even a bed. Just make sure when you're doing it that you have the chairs set in place and isn't going to move around too much, and if they are in a wheelchair, make sure those wheels are locked in so it's not going to move around on them. Before you also get started, you want to make sure that the patient has enough strength, both in their upper extremity to be able to lift themselves up and use the axillary crutches, as well as their lower extremity on whichever side is unaffected. For this, you're going to need a tape measure, a gait belt, and of course the axillary.
Sizing while the patient is in a seated position, we're going to have them abduct their arms all the way out to 90 degrees, and then go ahead and bend this elbow, and then we're going to measure across from olecranon process all the way over to the tips of the finger of the arm that is still extended out. Measuring across, you'll get your measurement here. This measurement then should be from the top of the crutches all the way down to the base. And then from the seated position, the patient will just have their arms relax out to the side, so we're going to put them down to the side. We'll then measure from the axilla down to the styloid process of the arm, and then that should then go from the top of the crutches down to the handle. So to get from a sit to stand, we'll go ahead and have the crutches on the side that is good. We'll go ahead and have them place their hands on here so they're able to grab under both crutches. The other hand will be supported over here on the armrest. The entire time the PT will be behind. They'll have one arm back on the gait belt and then one arm up on the shoulder to help guide the patient up. And then so non-weight bearing on the left leg here, we'll have them stand up, pushing from both the armrest as well as the handles on the crutches. So we're gonna go ahead and stand on 3, and 1, 2, 3. Stand up, good. And then we'll move one crutch over to the affected side, place it under the axilla, and then this crutch will go on this side. From here, we're able to do a confirmation of fit. So we want to be able to check there should be 2 to 3 fingers between the top of the crutch and the axilla. We're able to get 2 fingers in there, so it's a good fit. And then so to do a stand to sit, we're going to do just the opposite of all that. So it's going to take the crutch on the affected side, bring it over to the unaffected side. We'll grab onto the handle, and then we'll grab on the affected side of the armrest, and we'll sit back down. And that's everything.